In the world's race to end the pandemic COVID-19, there have been over 2 billion doses of vaccines administered in 178 countries so far. Ghana has administered more than 800,000 doses as of 30th May 2021, with current active cases of 1,092. The number of jabs given represents a little over 2% of the country's population. Let's take a look at Ghana's COVID-19 statistics right here on your screens. Ghana's COVID-19 cases versus vaccination. 852,047 people were vaccinated as at 7th May 2021. That's a representation of a little over 2% of the country's population. As at June 5, 2021, 94,369 cases had been recorded, 92,488 recoveries, 1,092 active cases, and 789 deaths recorded. Now, in a research conducted by the U.S. National Institute of Health, the rate of COVID-19 infections were seen to be directly influenced by the changes in weather and temperature conditions. Daily confirmed cases of COVID-19 were compiled from the Ghana Health Service and tested to see if they have any relationship with changes in weather conditions or temperature. The key findings are outlined in the following presentation, and it says weather and the spread of COVID evidence from Ghana. It shows that wind speed and atmospheric pressure influences the spread of COVID-19 infection, and the risk of spread changes for temperature between 24 and 29 degrees Celsius. The risk of spread sharply decreases when average temperature exceeds 29 degrees Celsius. And the risk of spread of COVID-19 significantly decreased for humidity between 72 and 76% and leveled afterwards, according to the research. And so you need to stay safe and observe all COVID-19 protocols. So let's have a conversation about this because of the rains and the fear that it could drive the spread of the virus. But there's also virtually nothing we can do to stop the rains. Joining me via Zoom is senior meteorologist at the Ghana Meteorological Agency, Michael Paddy. I'm grateful for your time, Mr. Paddy. The rains are in already, but tell us how much of it to expect for how long?
Okay, thank you very much. We are currently in June, and June seems to be the major rainy season and the peak of the major rainy season, especially over the southern half of the country. So we should expect frequent rains over most parts of the country. Over southern Ghana, we expect places slightly north of the coastline, that's parts of eastern region, the lower portions of Volta region, central, western, all these places to experience rainfall activities almost on daily basis. It will not be different also over the northern sector. Active storms are expected to track over the northern sector as well. These storms are expected to be accompanied by quite strong winds, so we have to prepare. And it is expected to last into July, whilst by August, we expect a reduction in the rainfall, especially over southern Ghana, whilst the northern sector continues to experience heavy showers.
I'm happy that you talk about preparation. So what should we do or not do?
Yes, as at this time, we expect citizens to be aware and clean their environment, especially drainage systems. Gutters should be desilted in order to allow free flow of runoff. If the gutters are choked with rubbish, then even a small amount of rain could lead to flooding because the water will not be able to get way to flow, and it will overflow into the communities and into people's houses to cause flooding.
I'm grateful for your time. Michael Paddy, Senior Meteorologist at the Ghana Meteorological Agency. Now, Ghana's coronavirus infection has seen a minimal increase in the last couple of weeks, even as health experts project a sharp rise in the number of cases in the coming weeks due to super spreader events that have been held over the period. According to the Ghana Health Service, the country's total positive cases stands at 94,369, with active cases as of June 5, 2021 at 1,092. 92,488 have either recovered or have been discharged. With the rain setting in, there are concerns that the change in weather could drive the spread of the virus, which has so far killed some 789 people. Dr. Michael Owusu is a virologist at KCCR and lecturer at the Department of Medical Diagnostics at KNUST. He will help us analyze the merits of concerns about the weather versus a spike in cases. Doc, I'm grateful for your time. We've had a couple of events that many describe as super spreader in the last few weeks, and now the weather is getting colder with the rain setting in. How concerned should we be?
Yeah, good evening to you, Aisha, and good evening to all your viewers. So, I mean, we have known from time, some years and decades back, that cold weather and rains seem to contribute to some respiratory infections. And you know that anytime you cough or sneeze, there are over 20 viruses that can be associated with this. And many of the viruses, particularly influenza viruses A, B, and C, and other human coronaviruses, which is not the non-COVID type, are all viruses that persist and tend to cause more transmission during the rainy season. And the reason being that, I mean, you know that studies have shown that as the temperature decreases, the viral load and the viral concentration also tends to increase. And people normally stay indoors whenever, I mean, it's raining or the weather gets cold. And as they stay indoors, they are likely to cough, sneeze, interact, and therefore transmission becomes quite high. So as people stay indoors and as they get cold and shed this, it's likely that this may contribute to a possible increase in the reproductive number of the virus, and therefore we will expect that every respiratory virus, including SARS-CoV-2, could increase. And we also have to be aware that it's not only SARS-CoV-2 that tends to cause problems in the rainy season, but influenza A and respiratory syncytial viruses also tend to cause problems. Even para-influenza viruses could also cause some numbers could go high during this rainy season, which is why we still have to ensure that we follow through these COVID protocols and put on the mask. I mean, mask is able to help use almost all types of the respiratory viruses. And once we adhere to this, we have a better chance of keeping this at low numbers and not allowing the transmission to go on.
So now that we are going to have a lot more rain and reduced sunshine, what new or different preventive steps should we take to keep safe and stem the spread of the virus?
Like we always say, I mean, the hygienic practices are very good. So it means that the need to keep washing your hand is one of the key strategies you could use, because if somebody sneezes or coughs and he gets these droplets on the hands and shakes within this season, the rate of transmission will be much higher than before. I mean, the weather is if it's hot and it's sunny, these droplets can dry quickly and dissipate into the air. But once it's cold, it takes some time for the droplets to dissipate into the air. So the droplets tend to remain on surfaces for a prolonged period of time, which means that if you're able to clean surfaces with your alcohol, 70% alcohol, wash your hand adequately, put on your mask, you have a better chance of keeping it at low numbers. But if you don't do that, it means that you cause the virus to survive on surfaces. And once they survive for a prolonged period of time, the chances of transmission and infection tends to increase. And these are things that can drive the virus numbers to go very high. So we still need to follow the protocols and ensure that we adhere to them even much better than we are doing before. And this is what I think can help us as a country.
Does the change in weather play any role in the warning of a possible third wave?
Well, it's a bit difficult to tell now. Third waves have their own ways that, they happen. One is behavior, and behavior contributes to this a lot. But then the rainy season or the cold weather is more of an opportunistic environment that viruses can use to survive and thrive. So if people are not following through the protocols, and then you have these variants get a chance within this season, they are likely to spread and move very faster. This is why we have to manage this very well. It's difficult to tell whether you're going to have a third wave because it's rainy season, because we don't have much evidence on the ground to suggest it. But then if you don't follow through the protocol well and the conducive environment is created for the virus, what it means that if one or two people even get in within this season, they have a better chance of causing possible outbreak and spikes than the people coming in during the high hot weather season. So we just have to manage this well and ensure that we don't do things that will create an environment for the virus to survive and to drive us to a point where we get to a third wave, which is something that can be very disastrous for us as a nation if we allow things to go that way.
Dr. Michael Owusu, I'm extremely grateful for your time. He's the virologist at KCCR and lecturer at KNUS State